Well, hi everyone. Good morning. My name is Mandy Arceneaux, and I'm the Associate Director of Marketing Relations for Lamar University. I also serve as the Marketing Manager for the College of Education and Human Development. This is a graduate session today to talk about public health and what it means to be a public health student here at Lamar University. Our goal is to answer any questions that you may have as they relate to being a public health student. We do have two guests with us today. First, we have Dr. Joshi, who is an associate professor and director of our public health program here at Lamar University. And we also have Kirsten McDonald here to talk about the advising side of the program. She is our academic advisor. Also joining us is Stephanie Broussard, who's the Assistant Director of Graduate Recruitment. So definitely a big thank you to Stephanie for organizing this today and for being with us. Just so the students who are joining us live know, your video is turned off and your mics are muted for privacy purposes. There's a chat option at the bottom of your screen. Feel free to use that anytime today as we're together. Ask any questions that you have and we'll do our best to get to those during our time together. The recording is going to be posted on our website, so you're welcome to go back and view this at a later date, and it will be closed captioned, so we'll be good there. All right, let's get started. Let's get to the good stuff. Dr. Joshi, I will turn it over to you. If you'll tell us who you are and all things public health, the floor is yours.
Thank you. Welcome and good morning. I'm very happy to be with you all today. My name is Praful Joshi, and I'm the program director for the Masters of Public Health program at Lamar University. I'm a dental surgeon by training and wanted to focus more in terms of treating community rather than individuals. And that interested me in understanding more about what goes on in community and what affects our health. And that's where I pursued my Master's of Public Health. And past that, I wanted to do more and understand about the consequences of health disparities and how to address that, and continued getting my doctorate in public health as well. And we started the MPH program at Lamar University in the fall of 2015. So our program, as you know, is specializing in health disparities, and the main emphasis of the program is addressing chronic health issues and any other population metrics that defines health disparities. So we have a unique blend of coursework within the program, which includes the core pillars of public health, which elements has biostatistics, epidemiology, health administration, environmental health, all these with a research perspective in health disparities. So that concept of health disparities is interjected in all these core courses, or what we call as the pillars of public health, so that our students are better prepared. And since spring of 2016, we have had graduates in public health program, and up to this point, we have had a number of graduates. The best part of the program is that we did a recent survey on the alumni of public health, and we were very pleased to report more than 99% of placement in terms of employment opportunities. So that is a very good thing our program has had. So we have had excellent placement. We also have had students who pursue into other doctoral programs as well. So our students are doing really good, and they range working in wide variety of settings. Some are employed in local public health departments, some are working in corporate settings, some are working in environmental health. So we have a wide array of job placements with our students. So I'll be happy to answer any questions you guys have today. And once again, thank you for being here and welcome to the program.
Thank you so much. I want to talk a little bit about what the classroom environment looks like, right? Is it in person? Is it online? What does that look like for students who may have been in the classroom for their undergrad and are transitioning to an online platform? What advice can you give? What does the program look like as far as the classroom structure?
We are a 100% online program, and 100% of the course material is asynchronous. What we mean by that is the course materials are programmed and students can access it anytime during the day or anytime they want, so long as they meet certain deadlines. Every course has defined modules, typically range about 8 modules or 4 modules. So they have specific deadlines they need to finish things in a given period of time. However, having said that, there is plenty of room for student interactions. So we have discussion boards where we discuss very interesting ongoing topics. In the last 6 months, we have been discussing in length about COVID-19 situation, how that impacts all the things we have always talked about in health disparities. So students have a very engaging discussion. And we also have what we call as virtual meetings. These are not asynchronous. These are actual live sessions, and they are also recorded for those who cannot attend it. So during these virtual sessions, we have a platform called Blackboard Collaborate Ultra, where students can video conference, they can ask questions to the faculty, they can also discuss within themselves. So that we have found to be very effective. And the new thing which we have also started is for the incoming students who are in Capstone 1, we are now doing a orientation session through Blackboard Collaborate Ultra, which has become very popular in the last couple of semesters. Students like it. So we have a lot of interaction that way as well.
Yeah, I love that you mentioned the discussion questions that students participate in throughout the week. Can you give us an example of about how many discussion questions are required and what the response requirement is and just what the engagement activity looks like?
So based on each module, the topic of discussion varies every week or for every module, depending on what we are talking about in the course. And typically, now once again, this changes for every course and every instructor. Typically, students are required to create their own threads. And these are, once again, graded discussions. So they are not just comment boxes. So the discussion post, we have the instructions for students is to have substantial content when they actually post all these threads. So it needs to have substantial comment. It needs to be relevant to a particular topic. And if they are making any assumptions or anything, they need to bring in those conclusions based on references. So we also ask them to provide references. No, need not be specific journal articles or anything. It can be from any website or anywhere. It could be non-scientific, so long as they give proper citations so that they are not just making up something. And the other requirement for discussions is that they need to have at least 2 minimum responses to what other students are posting. So we have typically way more than that what students do, but that's just the minimum requirement for grading purposes. And once again, in the instructions, we tell that some of the responses, which could be like, 1 phrase, 2 phrases, thumbs up, I like it, those don't actually count towards grading. What actually responses is, once again, that needs to have substantive content and something that adds to the learning platform. So in other way, what this is happening is we are creating a learning platform using students' discussions and their perspectives. So that makes a very good learning environment.
Yes, I agree. I'm glad you went into, I chuckled when you said, I like it or a great post doesn't count. I am currently in a graduate program and all of my professors have said the exact same thing. You cannot get in and just say, hey, great job. I like what you said. But you have to contribute to the conversation. And that is what really provides a really rich community feel in the classroom. It's a little bit different maybe for people to study online and, try to learn time management, things of that nature that they may not have had to do before. So they're not sure what it would look like to connect with students, but the discussion boards are truly a great way to do that and just really interact with the students and really dig a little bit deeper into the content that you're talking about. I know that's a really great portion of the class. Can you talk to the length of the program? How long is the program? How long would someone need to commit to completing their master's in public health?
So typically we say the program is averaging 2 years of program length.
Okay.
That's assuming students take 4 full-length semesters. However, in the last year and a half to 2, we have seen number of students who graduate around 18 to 20 months time frame. Now that summer is not optional, we have coursework going through summer. So it's become a 12-month program. So students are actually accelerating in the program. We also converted full semester courses to 8-week courses for most part. So those rotations are also enabling students to complete coursework much faster rate. So we are seeing a lot of students now graduate in the span of year and a half or just shy of 2-year time frame. So which has been very good. Once again, there is no set stone in saying that time frame because we have a great deal of flexibility. We have students who are employed full-time, majority of them, and they also have family and other obligations. So those who want to take their extended time can do so. So we have a good bit of flexibility for both options. Somebody who wants to accelerate, somebody who wants to take it at their pace, so long as they actually take all the core and required courses, they should be good.
Yeah. And do you know how many courses are in the program? How many classes they would be expected to complete?
So our accreditation requirement is 42 credit hours minimum for offering a Master's of Public Health degree anywhere, of which we have 6 hours of Capstone. So that leads to 36 credit hours of actual coursework. So that translates to approximately 12 regular courses, of which we have 9 electives. 9 credit hours of electives, meaning 3 of those courses can be done as electives in any of their given fields. So the rest of the program is core and required courses. So that's how our program is built.
Good. Awesome. You mentioned the word capstone now a couple of times. I remember when I didn't know what that meant, I asked a faculty member, what is a capstone? Like, what is expected in your capstone courses or course, depending on your program? And she laughed and said, it means you have arrived, and I want to get your perspective on capstone and what students can expect during that portion of their program.
There are a lot of terminologies used across the board, and it could be sometimes confusing. Some programs call it internship, some call it thesis, some call it applied thesis, practical experience. We use the term capstone regardless. There are 2 end components, what I say. One is called as APE, which is actually not that APE, it is applied practical experience. And the other one is ILE, which is integrated learning experience. So applied practical experience, as the name says, it is the work which students actually do outside of our normal core curriculum, which is like just the courses. So they need to get exposure in outside work settings. And this is what helps us immensely in job placement as well. So the minimum requirement for outside practical experience is 120 contact hours. And that has to be done, once again, outside of Lamar. It could be done in nonprofit organizations, hospital settings, anywhere. We have had, like, just as I mentioned in terms of works, employment settings, it could be done in corporate setting, anywhere. People have done all kinds of projects, very interesting. The second part is that a lot of programs have maybe like a comprehensive exam or some end product. In our case, we use ILE, which is integrated learning experience in public health accreditation. In our program, we use a professional paper as an end product that comes out as a means of completing their graduation requirement. So once students actually complete their outside experience, and then they translate what they have accomplished into the ILE, which is the professional paper format. So then it means that they have completed the graduation requirements. And this happens typically in the last semester. Now, having said that, that is not an easy task to do in one semester or even, 8 to 16 weeks. That's no way possible. And I have seen, other programs in, other universities where students jump into their thesis or practicum in their last semester, and they have done immensely good in all their courses, but then they struggle to finish this within the semester. What that does is delays their graduation, or they get frustrated, they drop out. So all kinds of things happen for good students who are already done because they're not, aware of what is coming up. So to avoid that, what we have done is we have stretched the capstone 6 hours into 4 sections, capstone 1 through 4. So incoming students, they're already oriented. They get oriented from day 1. So there are no surprises in our program. So they are told what is to be expected. This is what you need to be when you come to the first semester, second semester, and where you need to be in third and fourth semesters. So they already know, and they can prepare way ahead of time. And the beauty of our program is when we prepare students from capstone 1, 2, and 3, a lot of them actually complete their required practicum hours somewhere way before they actually enter capstone 4. So what that helps them is when they actually come to, ideally, this is what I always tell to students is ideally when they have already finished all their requirement in outside experience, they'll be only submitting papers, working on presentations, those kind of things in their final semester, which is very less stressful. They already know they have done their work. They know they'll be graduating. So they graduate with a smile. So that's the beauty of our program.
Man, that made me smile. I know that would make students smile. That's really good news, and probably a perfect segue into Kirsten's portion to talk about the advising. But I do have one other quick question for you. Congratulations on the 99% placement. That's amazing. That's a great stat for, I know you're proud of that for your program, but I wanted to ask, what do some of those employment opportunities look like? Like, what are some job titles that students hold once they complete their master's in public health?
It's a very good question because the job titles vary a lot. They can be called as simple as program coordinators for HIV/AIDS prevention, chronic disease prevention. Sometimes it could be in specialized areas like chronic disease epidemiologist. It can be, diabetes educator, nurse educator. There are all kinds of titles. In hospital settings, there could be administrator roles. It could be data analyst, public health policy decision makers. We also have had students who work in chain settings with the primary and secondary care, and they move up the ladder to become practice managers, practice administrators, those kind of positions. We have toxicologists in environmental health. We also have, health inspectors. That is also a very common job in, who do restaurant inspections, who do quality management, safety control, all kinds of jobs. So it just depends on what a person's interest level is, so they can expand that. We also have had students placed in corporate settings, as I said, in refineries, petrochemical plants. They do corporate wellness, so they do worksite wellness programs, coordinate for that. A lot of them also work in human resources, in benefits administration. So it depends on a wide variety of perspective, wherever public health can be utilized.
Yeah, that's great. Well, we do have quite a few students who have joined us live today. I just want to give you a final word, anything you would like to mention to them about the public health program here at Lamar University.
So there is no better time to be in public health than today. As we all know about the ongoing pandemic that just raised the alarm bells, and in the past, which the health system, which we had taken for granted, a lot of them didn't even know that public health units existed in their local counties, cities, or even in state. Now they are all aware of it. They know the importance of infrastructure in public health and analysis of data, the healthcare policy making, whether it goes from vaccination, wearing mask, or how data-driven policy making happens. So the number of beds available, all kinds of things, it opens up people's mind. So I think this is a very good time to be in public health. Also, the economy, there is going to be projected more jobs because of the ongoing pandemic. There are already thousands of jobs available, which we're unable to fill. So there is going to be, a huge increase in the healthcare workforce, but particularly in public health. More and more epidemiologist jobs are now needed in rural counties where they have almost no infrastructure in public health. So I'm actually asking students these days to apply for jobs in certain settings where I get information from. So there's plenty of job opportunities available in that setting. So I think it's a very good time to be in public health. And once again, Lamar prepares students to be in that level.
Wonderful. Thank you. I do see that we had one question come through that I'd like to ask. I'm going back to the discussion questions that we were discussing earlier. A student wants to know if the responses need to be in APA format.
Not necessarily for discussions. APA format is required for majority of the assignments and papers. We use the actual formatting of references. For the discussion threads, it's much informal because, as I said, references are generated whether it's from newspaper setting or wherever, so long as the message is conveyed. So discussion is more informal, but once again, it needs to have substance to it.
That's right. That's right. Okay, great. Great question. I'm glad we were able to answer that. And thank you so much, Dr. Joshi. I love hearing you speak on public health. I know you're passionate about it, so thank you for being with us. I do want to go ahead and segue over to Kirsten McDonald. We have a few minutes. I just want her to be able to speak on the advising side and any advice or knowledge that she can share with us on that. Kirsten, I'll turn it over to you.
Hi, everyone. So I'm Kirsten. I'm the academic advisor for the MPH program. My role is to assist students with planning their schedule, provide educational guidance, and also prepare the students on the path to graduation. So for any students that are, any prospective students that are interested in the program, what you would need to do is to submit an application at applytexas.org. Once you submit your application, you'll be required to submit the necessary transcripts from the previous schools you've attended. After your transcripts are received, the admissions office will place your application in review for the advisor, which is me. When I review your application, I'm looking to make sure that you have an undergraduate degree. If your undergraduate degree is health related, you will be accepted if you meet the GPA requirement, which is a 2.5 cumulative GPA or 2.75 in your last 60 hours of undergraduate coursework. Once it is determined that you are accepted, we will send you an acceptance email. You will actually receive 2 acceptance emails, one from the admissions office and one from the advisor. The acceptance email will have important information on how to register. It'll provide the schedule, which states the different start dates from each term, because we do have 3 terms in the spring and the fall. You have the option to schedule a phone appointment. We also conduct email advising, and some students like for face-to-face appointments. So you have the options of coming into the office. During your advisement appointment, you have the opportunity to ask any questions that you may have. We'll work together to determine how many hours you'd like to take in the program. You could either go part-time or full-time. However, the program will have to be completed within 6 years, and that's a graduate college rule. So far, we have several students in the program that have been very successful, and I enjoy working with all of them. And I look forward to working with you guys as well.
Great information. Thank you so much for being here. I don't see that we have any current or any outstanding questions that we haven't answered. So unless there's any final word from Dr. Joshi or Kirsten, I think, do you guys have anything else that you'd like to add today?
I don't have.
No? Okay, awesome. Well, thank you both so much for being here. I really appreciate it. Also, a big thank you to Stephanie Broussard, our Assistant Director of the Graduate Recruitment. She does a great job for our graduate program, so we're very grateful that she could be with us here today too. I do want to let our students know that, of course, anytime they can visit lamar.edu/education, find out more information about the public health program and all other programs that we have there. Faculty contact information there as well. So if you have additional questions that you want answered from today, or you think about it and something comes up, our website is a great resource where you can find good information and contact information as well to keep the conversation going and get you prepared well for your master's here at Lamar University, specifically in public health. Another great resource would be lamar.edu/visits, right? So campus is closed, unfortunately, to the public, so we don't have a lot of visitors these days, but that website, lamar.edu/visit, has great information there of ways that you can stay plugged in with Lamar University through the pandemic and, of course, beyond. So please remember those resources. Thank you to everyone for being here today. We really appreciate it. Hope you learned a lot about the master's program in public health, and we look forward to seeing you here at Lamar University. Thanks so much, guys. Bye-bye.